In this PowerPoint on hallucinogens, we will focus mostly on social issues and concerns related to this classification. Since the text provides a thorough overview of the different categories, specific types of hallucinogens, and the recreation, medical, and spiritual cultural uses, I will only make a few comments in those areas. When reviewing hallucinogens, this is a classification that has undergone several name adjustments. Currently, as the text points out, the two main categories in this classification are fantastica and deliriants. However, in the past, the categories were usually divided into psychedelics, dissociatives, and deliriants. These categories stem from the specific hallucinogens that were popular and the cycles of use. When describing some general effects of this classification, this can be a little complex. This is due to the vast number of hallucinogens that fit in this classification. However, even with this large number, one common effect of all hallucinogens is the ability to produce altered perceptions of some kind. From there, more detailed effects really depend on the specific substance. When discussing hallucinogens, this is a classification that has a long tradition of medical, therapeutic, and cultural spiritual uses. Historically and across cultures, many hallucinogens have been viewed as sacred plants with a range of healing properties. They have been regularly used for medicinal and therapeutic benefits as well as for spiritual and ceremonial purposes. Turning to social issues and concerns, currently there are several topics in this area. The first relates to the research efforts to better understand different hallucinogens and their potential healing properties. There is currently a resurgence in studies and research in this area. However, this is being met with different opinions. Some disagree with viewing hallucinogens as having medicinal potential and do not support this type of research and application. This opinion partially stems from past research attempts in the U.S. During that time, concerns of a lack of ethics and proper adherence to research protocol using human subjects were noted. In addition, there were many reports of a lack of transparency and risks when conducting research. Both of these issues influenced the decision to stop research in this area. While research efforts involving hallucinogens did continue in other countries, it was largely discontinued in the U.S. However, this has changed. Research efforts at Johns Hopkins University, the University of Miami, and UW-Madison, to name a few, have begun to focus research efforts again on better understanding their healing potential related to many conditions. Another social issue and concern relates to who is providing the therapeutic and spiritual care. As noted, hallucinogens have been used for medicinal and spiritual care in many cultures. In these situations, they are used under a well-trained traditional healer who has extensive understanding of the properties of the hallucinogen being used and closely observes the therapeutic process. When used for medical or spiritual guidelines, it is critical that the process be under the guidance and care of someone who is specifically trained and can intervene if adverse effects present. However, there have been many reported cases of individuals without proper training or medical licensure administering hallucinogens and not providing proper care or observation. Many of these have led to fatal or near-fatal outcomes. Due to this, it is critical that any therapeutic or spiritual use of hallucinogens be under the direct care of a true traditional healer or trained medical professional. Another current social issue and concern involves designer drugs and new psychoactive substances. Hallucinogens are a classification that has experienced a substantial increase in designer drugs. One of these is 2-CI, also known as smiles. 2-CI is actually a research chemical from the 1960s that has been experiencing a resurgence. The effects can be very strong, and many reports of psychotic symptoms and explosive behaviors have been reported. Another one is MDMA, which has come in several different forms and derivatives. In the past, many were familiar with the name ecstasy or Molly. What is important to note about this type is that the effects produced are actually a combination of the hallucinogen and stimulant classification. So, it is often viewed as a combined effect. In addition to MDMA concentrations, there are other types that fit under this hallucinogen-stimulant combination. Lastly, when discussing social issues and concerns, we will explore toxicity, dependence, and addiction potential. When looking at acute toxicity, many hallucinogens have the potential to result in risky health consequences. There have been reports of severe heart arrhythmia, overheating, and loss of consciousness, among other medical conditions. Some of these can be fatal. On the topic of overdose, the overdose potential has received some debate. However, due to many possible health complications and experience described by those using hallucinogens recreationally, overdose potential should be taken seriously. When looking at dependence potential, this classification offers some uniqueness. Looking first at physical dependence, none of the hallucinogens have currently been found to produce physical dependence. While there can be some tolerance issues, it is not enough to generate withdrawal symptoms or physical dependence. However, when looking at psychological dependence, hallucinogens are known to generate psychological dependence. As a result, even without the ability to produce physical dependence at this time, hallucinogens would be listed as having addiction potential based on the ability to produce a psychological dependence. Lastly, when exploring chronic toxicity, one of the main issues in this area involves substance-induced disorders. When we first discussed substance-induced disorders, it was presented that the vast majority of these fall under the short term, meaning once the person has stopped use of the substance, the symptoms that mimic a mental health disorder will also stop. However, while rare, the potential for persisting and permanent mental health symptoms do exist. Hallucinogens is the classification often noted to potentially produce the long-lasting permanent type. In addition, a condition known as HPPD, hallucinogen persisting perception disorder, can also occur. This involves re-experiencing the perceptual disturbances commonly experienced from hallucinogenic use, but after the use has actually stopped. HPPD can potentially persist for weeks, months, or even years. More information to fully understand the workings of this condition are needed. However, while it is known that this is a real chronic condition, many individuals with HPPD learn to manage the symptoms enough to function sufficiently and maintain quality of life.